All right, so a new case today for Obamacare in terms of changing the way that employers do business. A report that Walgreens is about to make sweeping changes to their health care benefits program, giving employees a set amount of money so they can go out into the exchanges and choose their own medical coverage and insurer. Stuart Varney is host of Varney and Company on the Fox Business Network, and he joins me now. This is becoming a familiar refrain that we're hearing, Stuart.
It is. Do you remember the shift in pensions maybe 30 years ago when you went from a company offering a guarantee of a pension to a company giving you a contribution towards it? Well, this is very much like that. Walgreens, 160,000 employees. They're telling them, you don't get health care directly from us anymore. You're going to get a check. And you can take that check and you can spend it anywhere you like within the range of choice on health insurance policies from a private exchange. Walgreens is saying, we can't afford the constant rising costs in healthcare, and we cannot afford the cost of compliance with Obamacare. So we are making the shift. A lot of other companies are doing the same thing. It is a huge shift in what your employer offers you for health insurance.
And people from fast food franchises, including McDonald's, going to D.C. to lobby for changes in this law, right?
Yeah, that's another hit on Obamacare, if you like. 300 franchisee representatives arrived in Washington this week. They swamped Capitol Hill, they went to all the offices, and they're saying, look, you've got to change Obamacare and change it big time. We can't have this 30 hours or more. You've got to have health insurance. It's got to be 40 hours. We want our people to work as many hours as they can, so you've got to shift it from 30 to 40 hours as the cutoff point for defining part-time work. That would be a very big change in Obamacare, and they're pushing hard for it.
It sure would. The outcome of that is going to be very interesting. And when you look back to, if you like your health care plan and you like your doctor, you can keep it. Those words ring in everyone's ears when you think about this whole discussion. And it's not so for people at Walgreens, people at IBM, people at Time Warner, a whole bunch of places. So, Stuart, thank you very much.
And I think that sentence concludes with, maybe not. Yeah. But this is the beginning of a flood. We talked about it last week. When the big companies step up and say, we're going to change the policy, many others will follow.
And it flies in the face of what you're hearing from the president, and we'll hear it today as well, that premiums are going down, that costs are going down. So if costs were truly going down, what would be forcing these companies to push people off of their roles and onto this, here's your check, and,
These are great questions. It's going to be a new world very soon here now. Now, did the politicians and the media get it wrong on Monday?